Hello, I'm Public Health Commissioner Jeff Howard. Today I would like to talk to you about Kentucky's public health system. Kentucky has 61 local health departments comprised of 14 health districts and 42 independent county health departments. In total, we have one local health department in each of Kentucky's 120 counties. Kentucky is one of only 3 states characterized as having a shared governance public health structure. In this system, both state and local agencies share decision-making authority for the actions of local health departments. At the state level, the governing authority is the Department for Public Health, which is housed in the Cabinet for Health and Family Services. The local governing agents are the local boards of health, constituted by community members appointed by the Department for Public Health. As members of the medical community, you may know that public health is the science of protecting and improving the health of the population and their local communities. Accordingly, the mission of the Department of Public Health is to improve health and safety of Kentuckians through the 3 Ps: prevention, promotion, and protection. Our goal is to provide every Kentucky citizen with high-quality public health and the opportunity to improve their health outcomes. What you may not know is that Kentucky's public health system was recently faced with a time of unprecedented instability and uncertainty. The system was confronted with a pension crisis of such severity as to threaten the financial solvency of more than half the state's local health departments. The stark reality was that 41 local health departments representing 4 districts were at risk of fiscal default in fiscal year 2020, just a 12-month period. The current public health system is comprised of programmatic service offerings that are not always rooted in local public health needs or priorities. While Kentucky ranks fairly average in spending on public health costs, the state rates 45th in terms of health outcomes. The fact that we are spending middle-of-the-road dollars to achieve results that fall in the bottom percentiles serves as a stark reminder that progress is still needed. That being said, Kentucky's current public health system was also poised to take advantage of this unprecedented opportunity. Just yesterday, House Bill 1 was signed into law and gives our local health departments a 1-year reprieve from the increases in pension cost. Importantly, House Bill 1 provides our health departments with a year to fully adopt our public health transformation plan. We recognize that our entire public health system must change, and the process must yield a system that is modern, simplified, focused, and yet accountable to the measures that we all deem important. Our transformation plan seeks to simplify, focus, and prioritize the entirety of the public health system in Kentucky. The plan simplifies service offerings to focus on core public health, the most important services we offer, plus important programs such as WIC, HANDS, and harm reduction and our substance use work. In short, core public health services are services that no one else in our communities offer, and they involve communicable disease control, emergency preparedness and response, and enforcement of regulations, just to name a few. If the public health system does not offer these services, Kentuckians will not receive the benefits, safety, and care they deserve. Although House Bill 1 provides immediate relief for the local health departments facing the increase in pension costs, we have our work cut out for us. Over the past few months, in order to preserve this vital public health safety net, local health departments have begun making significant changes that align with our community-focused transformation plan. In fact, in the last month, I have met with 14 of the 18 local health departments that are at risk for financial insolvency, and I am quite happy with the progress that they've made. We, out of necessity of situation, are committed to tackling the difficult feat of transforming the foundational structure and organization of Kentucky's public health system. We are excited to jump all in on community health prioritization in an unprecedented manner, and we believe that our focus on community can produce better health outcomes for our citizens. However, we realize that this is a formidable task. We cannot do this alone. At the state and local level, we are committed to strengthening existing partnerships as well as identifying new and supporting non-traditional and traditional partnerships within the community for the achievement of the shared goals of creating sustainable, healthy communities. We must work together to build strong partnerships to increase the impact of sustainability of health improvement. This requires that our physicians, who are de facto community leaders, participate in the public health system. This can happen in many forms. Visit your local health department and discuss your practice and interests with your health department director. Consider joining a local board of health. These are all great ways that you can be involved. I'm also happy to announce that in the very near future, we'll be partnering with CE Central and the University of Kentucky to offer continuing medical education credits in public health, which will be available online, and I hope you take advantage of that opportunity. I ask that you join me in the commitment to improve the health outcomes of Kentuckians for our future and our future generations to come. I truly believe we can build for ourselves a system that allows us to improve health for all Kentuckians. Thank you.